All right, so today we're going to be looking into Clover Health.
Clover Health.
They're making some pretty big claims
Yeah.
about changing healthcare, and they're saying that they're going to make affordable, high-quality care available across the entire U.S.
For everyone?
for everyone using data,
With data as the key.
with data as the key.
Right.
And you've brought us some really interesting stuff today to help us unpack this.
I did. I have
Articles, videos,
articles, videos.
stock analysis.
Yeah, even some stock market stuff.
Yeah.
So we can really try to figure out what's going on with this company.
So it's a bold vision,
It is a bold vision.
especially considering the state of the U.S. healthcare system, which is often criticized for being anything but affordable.
Yeah, so are they actually revolutionizing healthcare, or is this just like really clever marketing?
That's the question, isn't it?
Yeah.
It's easy to get caught up in the hype,
Right.
but we need to look deeper. Yeah, and at the heart of what they're doing, it seems like, is this thing called the Clover Assistant.
That's right. The Clover Assistant is really key to their strategy.
Their data-driven software platform.
Yeah, it's a software platform that uses machine learning to provide doctors with real-time data insights during patient visits.
So it's almost like a virtual doctor in your pocket.
Well, not quite in your pocket, but definitely in the exam room with doctors.
Okay.
It's there to support them, not replace them.
Right.
But we're talking about some pretty advanced capabilities here.
What kind of insights are we talking?
Well, we're talking potential diagnoses, treatment plans, medication recommendations,
Wow.
even down to the dosage level.
Okay, that's pretty impressive.
It is. It's using data to help doctors make more informed decisions in real time.
So before we get too lost in the weeds of how the algorithms work,
Sure.
can we just take a step back?
Of course.
Where did this company even come from?
So the story starts with Vivek Garipalli.
Vivek Paul.
He's a healthcare veteran who saw the potential of Medicare Advantage
Oh.
and how data could be used to improve care. And he co-founded Clover Health back in 2014.
2014. And their growth has been, well, let's just say meteoric.
Yeah, the numbers are pretty staggering.
They are.
They went from 40,000 covered lives in 2019 to a projected almost 600,000 by 2023.
That's right.
That's massive.
Yeah, that kind of growth is fueled by more than just good marketing.
Right.
They've tapped into both the traditional Medicare Advantage model and this intriguing new direct contracting approach,
Direct contracting.
which we should definitely dig into later.
Yes, you're sure.
It's a key part of their strategy.
They're not afraid to shake things up.
Not at all.
Let's get back to this Clover Assistant for a second.
Okay.
How does it actually work and what makes it so unique?
So imagine a doctor seeing a patient, right?
Okay.
They input the patient's symptoms and medical history into the Clover system. And in real time, the software starts crunching data.
Crunching data. Yeah. It looks at similar cases, research best practices, and flags potential diagnoses the doctor might not have considered.
So it's like having a super smart consultant by their side,
Exactly. It's
Right.
like having a second set of eyes,
constantly cross-referencing information.
constantly analyzing data and providing insights.
That's amazing.
And it goes beyond just diagnoses.
Real.
The Clover Assistant can suggest specific tests,
Oh, wow.
compare medication effectiveness based on the patient's history, even factor in things like potential drug interactions.
I can see why people are excited about this.
Yeah.
This could be a real game changer for doctors.
Especially those who might not have access to all the latest research or the time to sift through mountains of data themselves. It
Yeah.
helps them make more informed decisions more quickly.
Right. And Clover Health is in a unique position to do this because they're both an insurer and a healthcare provider.
That's right. They have access to a vast amount of patient data,
Right.
which allows them to train their algorithms in a way that most traditional healthcare providers can't.
So they're using this data to actually improve patient care.
Exactly. They're not just crunching numbers for billing purposes.
Right.
They believe that better data leads to better care,
Better data?
and that this will attract more members, which in turn generates even more data to further refine their system.
They call this a virtuous cycle.
Exactly. A virtuous cycle of data-driven improvement.
Okay. But healthcare is really complicated.
It is.
And humans are not always predictable data points.
That's true.
Can an algorithm truly account for all the nuances of a patient's needs and their specific conditions?
That's a crucial question.
Yeah.
And one that I'm sure even Clover Health grapples with.
Right.
But it's important to remember that they're not replacing doctors with robots.
Right?
The Clover Assistant is a tool,
The tool.
a very sophisticated tool.
Yeah.
But ultimately, it's up to the physician to make the final call.
So it's like having a co-pilot in the cockpit.
Exactly, a co-pilot who can provide valuable information and support.
but the pilot is still in control.
Precisely, the doctor is still the one making the decisions.
Okay, and Clover Health says they're being very transparent about how they use this data
They are. They're very upfront about it.
and that they prioritize patient privacy
Absolutely.
and follow all the HAPA regulations.
All the regulations are being followed.
Okay, well, that's reassuring.
Transparency is crucial in healthcare,
Absolutely.
especially when you're dealing with sensitive patient data.
Yeah, but even with all that transparency,
Sure.
I mean, you can't deny that there's a certain level of skepticism
Of course.
when any company claims that they're going to disrupt
Right.
an industry as entrenched as healthcare.
Especially healthcare.
Yeah.
It's a tough nut to crack.
And Clover Health has had its fair share of controversy,
They have.
particularly around its CEO
Uh-huh.
and some of its financial dealings.
Yeah. Their stock performance has been anything but stable.
A roller
A
coaster.
real roller coaster ride for investors.
Speaking of drama, we've got a lot to unpack there.
We do.
From the allegations of mismanagement at hospitals in their biggest market
Right.
to the shadow of that Hindenburg research report.
Yeah, that report definitely raised some eyebrows.
Every time, it seems like they take a step forward.
Something tries to pull them back.
Yeah.
It's been a bumpy ride.
So can Clover Health actually deliver on its promise
That's the big question.
of this affordable, high-quality care for all?
Affordable, high-quality care for everyone.
Or will they be crushed under the weight of
The complexities of the healthcare industry.
the complexities of the healthcare
That's
industry?
a tough industry to disrupt.
To answer that, we need to take a closer look at their growth strategies,
Absolutely.
especially this direct contracting model.
Direct contracting is a key part of their plan.
It seems like a pretty bold move.
It is.
But is it sustainable?
That's what we need to find out.
Okay, let's dig in.
Let's do it. Direct contracting is definitely a gamble.
A gamble, how so?
Well, it's a new approach,
Okay.
but it has the potential to really shake up the Medicare landscape. Okay.
Basically, it lets Clover work directly with doctors
Okay.
to give care to their patients who are on original Medicare.
So they're like bypassing the traditional Medicare Advantage plans,
Yeah, they're cutting out the middleman.
going straight to the source.
Exactly.
Okay, and that gives them access to a much larger pool of patients, right?
Huge pool.
Yeah.
I mean, they already have 200,000 people signed up through direct contracting,
Wow.
and they're expecting that number to grow a lot.
Okay, but what's in it for the doctors?
That's a good question.
Why would they want to partner with Clover?
Well, think about it. They're already established with original Medicare.
Yeah,
So why switch things up?
right.
Well, this is where the Clover Assistant comes in.
Ah, okay.
By using this tool, doctors can potentially see better results for their patients.
Okay.
Fewer unnecessary hospital visits and readmissions.
Gotcha.
And they can streamline their practices, make things more efficient.
Makes sense.
Plus, Clover offers them financial incentive
Financial incentives.
if they meet certain performance goals.
So it's a win-win.
Exactly.
The doctors get access to this cutting-edge technology.
Right.
They get some financial rewards.
Yep.
And Clover gets to expand its network and gather even more data.
More data to refine their algorithms.
It's a classic disruption strategy.
It is.
Use technology to create a more efficient system.
And incentivize the key players to join your team.
But we can't ignore this whole controversy with Clover's CEO.
Vivek Garipalli.
Yeah, and his connection to CarePoint Health.
Yeah, that's definitely a concern.
These hospitals in New Jersey.
One of Clover's biggest markets.
Yeah, they've been having some financial problems.
Big financial problems.
And there are these allegations of mismanagement.
It's not a good look.
And Garipalli says that his involvement with CarePoint was completely separate from Clover.
That's what he says.
But it just doesn't look good.
It raises questions about his leadership.
And whether these problems could affect Clover's reputation.
Exact.
And then we have that Hindenburg research report.
Oh, yeah.
Now, it was mainly focused on a different company.
Right.
But the fact that Hindenburg had previously bet against Clover.
And accused them of misleading investors.
Yeah, it makes you wonder.
It definitely casts a shadow.
So on the one hand, we have Clover Health presenting this compelling vision.
The data-driven healthcare.
Potentially improving care.
And lowering costs.
For millions of people.
Millions.
But on the other hand, we have all these controversies.
And questions about their long-term viability.
It's like a paradox.
It is a fascinating paradox.
So what does this mean for our listener?
That's the question, isn't it?
Where do you stand on Clover Health?
Well, I think it's important to look beyond the headlines.
Okay.
Don't just take things at face value.
Right.
Dig into the data.
Okay.
Look at their financial performance.
Uh-huh.
Read independent analyses of their technology.
Okay.
And consider all perspectives.
From both their supporters and their critics.
Everyone.
But let's not forget about the human element here.
The human element is crucial.
At the end of the day, healthcare is about People.
Patients, doctors, nurses,
That
all
was-
trying to navigate a system that can be very confusing.
And often frustrating.
Absolutely.
Can technology like the Clover Assistant
Yeah.
actually make things better for them?
Can it improve their experiences and lead to better outcomes?
These are important questions.
Big questions that we need to be asking.
As we figure out the role of technology in healthcare.
The role of technology is evolving rapidly.
Is Clover Health a glimpse into the future?
A future where data empowers us
To make better decisions?
and access more affordable care
Or are they setting themselves up for failure?
by overpromising and underdelivering.
Maybe the most important question is this.
Okay.
Can a company that says they prioritize patient care
Uh-huh.
actually thrive in a system that's driven by profits
That's the fundamental tension.
that Clover Health and the entire healthcare industry are dealing with?
A tension that our listeners should be thinking about.
Yeah, as they continue to learn about Clover Health,
And the future of healthcare.
they need to consider the implications of this approach.
And ask themselves,
What kind of healthcare system do we want to create
for ourselves
for our families?
and for our communities.
It's a question worth pondering.
Yeah.
It's easy to get lost in all of this.
Yeah.
All the data and the numbers and the
The financials, the stock market.
stock market stuff, yeah. But
It's easy to forget.
we have to remember that healthcare is really about people.
Absolutely. At its core, healthcare is deeply human.
Yeah, behind every data point, every stock ticker change, there's a patient,
Hoping for answers.
a doctor just trying to do their best for their patients
Right.
and families
Families struggling
struggling with illness and the costs.
with all the challenges that come with it.
That's why I think this Clover Health story is so interesting.
It is.
It really gets at our hopes and fears
About the future.
about the future of healthcare. Yeah.
What's it going to look like?
Will technology help us?
Will it make things better?
Will it give us better care? Will it make it more affordable?
Or will it make things worse?
Yeah, will it dehumanize healthcare?
Turn us into data points.
Yeah, just data points in a giant algorithm.
That's a scary thought.
And that's where our listeners come in.
That's right.
You listening to this right now, your understanding of this is so important.
It's crucial.
You're the ones who need to be having these conversations.
We need to be informed.
Don't just take what companies and politicians are telling you.
Dig deeper.
Ask the hard questions.
Demand better.
Demand better from our healthcare system.
We deserve a healthcare system that works for everyone.
This deep dive into Clover Health has been a wild ride.
Yes.
So much promise, but so much controversy too.
A real roller coaster.
We've talked about their technology, their growth strategies, all the ethical questions.
The challenges they're facing.
Yeah, they're really trying to shake things up.
They're not afraid to push boundaries.
But there are risks.
There are always risks when you're trying to disrupt an industry like this.
And we can't forget about the human impact of all of this.
People's lives are at stake.
So as we wrap up today, I want to leave you with one final thought.
Okay.
Clover Health's story.
Win or lose.
Yeah, no matter what happens to them.
It shows us that healthcare is changing.
It's a microcosm of this bigger transformation that's happening.
Technology is changing everything.
And we have to think carefully about how to use it.
For good.
Yeah, how to use it to make things better.
Without losing sight of what's important.
What kind of healthcare system do we want?
For ourselves.
For our families, for our communities?
That's the question we need to be asking.
Do we want a system that's just about profits?
Or one that puts patients first.
One that empowers everyone?
Patients and providers alike.
These are the conversations we have to have.
If we want to create a better future for healthcare.
This has been The Deep Dive. Thanks for joining us on this journey into the world of Clover Health.
It's been a pleasure.
Keep learning,
Yeah.
keep asking questions, and keep pushing for a better healthcare system for everyone.
We can do it by